Hello, it's John Canalabos here from our center in Athens, Greece, the Laser Vision Clinical Research Institute. I want to share with you some very important information in evaluating what you can see here, a cataract patient. The only particular thing here with this gentleman, he's in his mid-60s, is that we had undergone together a hyperopic LASIK procedure 10 years ago, exactly 10 years ago, and that did well. We can see the hyperopic correction on the pentacam maps and the topographies of the, this is a right eye. We can see that the cornea has been steepened centrally by laser. Also very signature, the angle kappa that the hyperopic patients have. It's on our topographer shown as the XY deviation of this image. And IOL calculation. So we have to take into consideration the hyperopic correction. We usually add, actually take out a diopter and a half from what the actual calculation would be with today's numbers. We can also see here on the OCT images the LASIK flap. We can see kind of the border of the LASIK flap here. This is a thick flap, 160 micron flap with the LASIK that was performed in the past. We also use, of course, the ASCRS calculator, but just to look at the numbers here, we would take, for instance, the lens that will give us emmetropia, which would be a plus 19, and take out a diopter and a half in hyperopic patients, add 2 diopters in myopic laser vision correction patients. And this is our own intrinsic formula. Now, as far as the ASCRS calculator, the numbers were similar. And we ended up with a result, and this is the patient today. We're at 5 weeks post-op. We can see stellar lenses. And our goal was planar on the right eye, which is the dominant eye, and minus half a diopter on the left eye. The problem was that in the first few weeks, the patient was significantly hyperopic. He was a +2 on the right eye, and then a +2 as well in the left eye. And I'll show you why. The reason why is, let's look at the change in the keratometries. In the past, his keratometry in the right eye was 43.5, let's say, in average. And after the surgery, it dropped to 42.8. So the cornea is flatter, almost a diopter. What is that? That's a sign of some mild cornea edema. And as time goes by, even at the 1 month, actually this is 2 weeks after, this is 3 weeks after, and this is 5 weeks after. And you can see how keratometry jumped back to the preoperative, which is 43.5, and thus the automatic spontaneous correction of the transient hyperopia that this patient went through the first post-op month. So this is the take-home message here is we wait. We'll see similar numbers in the left eye. Again, the pre-op 43.25, 43.5, going down to 42. So a diopter and a half change, flattening of the corneas as the cornea is healing transiently, ending up at 43.5 today. And today we're enjoying visions of 20/20 in the right eye at distance. 20/30 plus in the left eye at distance, with a anticipated minus half refractive error in the left eye, and his ability to see with both eyes, J5, and reduce the need for intermediate glasses, intermediate distance computer, and eating food, preparing food. So we'll just have reading glasses here. Again, how looking at the data is proof in the pudding on how the cornea has changed. We'll also look at the cornea pachymetry images here, 538 in our last visit just a few weeks ago, 530. So the cornea has thinned, has steepened in this particular situation, and has affirmed our preoperative calculations. We also, at this point, look at the macula, make sure that once steroids are off, we don't have rebound CME. We use a tail of 2 weeks of Bromfenac This is again the comparisons of pre-op to post-op, another area that we spend special attention and special care. So we saw the right eye comparisons, and this is the left eye comparisons of pre-op to post-op today. So non-incidental healing after cataract surgery. We're very pleased that we can reinstate the clarity and uncorrected visual acuity for this gentleman. And this is John Canlopoulos signing out.